X-ray in dentistry. Why do we have to take X-ray of your teeth when you come for checkup? Now I'll show you. So this is what is called periapical X-ray. Is the X-ray that we check each individual tooth like very carefully, like very thoroughly. We have to see the tooth root canal, the bone around the tooth, periodontal ligament space, and any lesion around the tooth. This is what we check. See, we also check like if there is anything in your bone in this area. If the patient wants to get dental implant done, we have to check too. Like if there is anything in the bone. We also can check how thick the bone is. For example, we want to put dental implant in here. We want to know how thick the bone is. We can also measure the height of the bone. And we can also measure the length of the tooth roots. For example, if we need to do root canal treatment for this tooth, we want to know how long the tooth root is. We can also measure it just like this. So this is the length of the root canal that we have to put the instrument in there. Yeah, we call the root length. And we can also check how deep the cavity is. So just like this, when you have cavity, we want to know how deep the cavity is. And we want to see if there is any infection inside the tooth or around the tooth root. Like this tooth, for example, there is a nerve inside the tooth. We want to see if the cavity that you have is exposed to the nerve or not. This is the reason why we need to take X-ray when you come to get the filling or even teeth cleaning. In some case, I also take X-ray because I want to see how everything is exactly is. Yeah. When we do a dental checkup, it's not just we look at your teeth and then done. We need to look to like check every teeth all around, see how your gum is, and see how like everything is. We see so many things. We cannot explain everything to you. Like we cannot explain everything that what do we look. We have to look for everything that is abnormal or that is suspicious. So this is the reason why we need to take the X-ray for you.